My name is Priscilla Valenzuela, and on behalf of the Riverside Community Health Foundation, we would like to welcome you to the Palliative Care, Complex Pain, and Symptom Management at this year's virtual SoCal Women's Cancer Conference. We will be selecting questions to answer during the Q&A portion of this talk, so send us your questions via the chat feature throughout the presentation. Also, if you like this talk, please click on the thumbs up button or drop us a comment to let us know. We always love hearing from you. And if you need any support accessing any of our talks on our virtual conference page, please email us at terry@rchs.org. That's TERRI@rchs.org. And now it is my pleasure to introduce you to the board certified internist, and geriatrician, and palliative medicine specialist from St. Joseph's Hospital, Jamie Fertal.
Good afternoon, everybody. Thank you for coming to hear me speak. I was very excited to have the opportunity to talk to you guys about my very favorite topic in the world, which is palliative care. So as I was giving some thought to what might be useful for this audience to hear from me, I decided to sort of take you behind the curtain, if you will, as a manner to explain what palliative care is by kind of telling you what a palliative care doctor is thinking about as they are caring for you and meeting you and trying to figure you out. So let's get started. Okay, so what are you thinking? And again, that has a double meaning. Palliative care tends to have some incorrect assumptions about it in terms of how involved it is with end of life care. And I'm here to kind of smash some of those incorrect thoughts and welcome you to the thought process that palliative care is actually something that has to do very much with life. And what are you thinking is also me kind of letting you into what we're thinking. So what's the point? And I meant that in probably the most general sense of the word. What's the point of life? What is the point of getting up every day? What's the point of seeing a doctor? What's the point of seeking medical treatment for certain problems and maybe not others? The point, I will say, is that you decide. You decide what your own point is. You decide what your own goal is. You decide what the most important thing for you is in your life. Now, how does that become relevant? Well, it's one of the huge concepts in palliative care is quality of life. And for many, many people, that is the point. So one of the ways we utilize that philosophy is, in palliative care at least, is that when you're dealing with medically complex patients, which I'm sure there are a few out in the audience, the number one thing that I think about is to change the things that you can change, but only if you want to change them. As an example of that, pain, which is one of the big topics in palliative care, pain is generally changeable. Not always, but in general, it's changeable, and it's important to change it if that is what you as the patient wants. So as I said before, I thought it would be useful to talk about the things that your palliative care doctor is thinking when they spend time with you. And again, I'm hoping by the end of this, you'll have an idea of the extent of what palliative care is. So I do want to suggest that these are questions that I would, for example, teach other doctors who are trying to learn about palliative care. But I suggest that a lot of these questions are actually very appropriate to ask yourself if you are not feeling well, if you are going through medical treatment for something complex. I would suggest to ask yourself these questions, and it may be enlightening. So let's kind of start with the concept of total pain. The concept of total pain is the notion that physical pain, like the feeling you would feel if someone punched you in the eye, is really only one component of what pain is. There are different parts of pain, and together they form the concept of total pain. So physical pain, like I said, that would be probably a black eye. Social pain involves things like embarrassment and shame and things like that that can go along with certain disease states. Psychological pain or emotional pain and spiritual pain. These are all part of one pie that make up the potential pain of any human being. So I'm going to pick that apart just a little bit for you. So one of the simpler ways I have found to pick that apart, and again, as a doctor, I am trying to kind of pick apart my patients, is to divide them up into domains. So the physical domain, and this is again my kind of everyday interaction with patients. Pain is probably the simplest thing to talk about. So we talk about, where is your pain? What does it feel like? Where did it start? Does it go anywhere? Is there anything that makes it better? Anything that makes it worse? Any other mitigating things that you've noticed about it? All of those pieces of information, when a doctor is talking to you, are going to be absolutely golden and extremely valuable. So if you're going to be talking to a doctor, we're going to be wondering all of those things. Another division of the physical domain isn't really to do with pain at all. It has to do with some of the basic functions of life, like nutrition, GI. Are you able to put food in, and are you able to let it out? So eating, going to the bathroom. There are so many issues that can occur with the normal function of eating and going to the restroom. Just a couple examples include nausea, anorexia, or the medical term for anorexia means that just no interest in food, not necessarily the psychiatric problem. Are you able to have bowel movements? Are you very constipated? Are you very bloated and gassy? Then we sort of try and at least acknowledge the effect that impairment of your senses, sight, hearing, taste, those are all huge physical parts of your being. And as we get older and as our body becomes, slightly becomes affected, if you will, because of a disease process, you may lose your ability to see or hear. And that, of course, can make everything much, much more intense and negative. Function, again, kind of going back to GI. So if you have the desire to eat, and if you're lucky to not experience nausea, well, then we have to go, do you have the ability to swallow? Is there something with your anatomy or with your disease process that is getting in the way of being able to swallow, whether it be food or water or medicines? Mobility is huge. Very, very directly tied to your strength and your coordination is mobility, your ability to walk in the places that you need to walk, or your ability to skillfully use some sort of adaptive device, such as a walker or a wheelchair. Then there's a whole completely taboo subject of sexual function in the context of severe disease. Just like that old joke says, old people still make love. Well, people who have illnesses still make love if they can. And it is a very important part that when it's missing can be devastating. And then finally, incontinence is another part of function that when it's absent can be absolutely mortifying. So it's kind of a bridge to the social aspects of, what if you aren't able to make it to the toilet? What would that do for your desire to spend time with friends or outside the home? And then just the logistics. Does it smell bad? Do you have the facilities in which to tidy up? So I already kind of started to talk about the implications of dysfunction of your body. If you can't enjoy the taste of food, if you can't use your wheelchair appropriately, if you can't be intimate with your spouse, all of those things can affect your life so deeply. Um, I also want to take a second to acknowledge that there are a fair number of symptoms that are extremely difficult, even more so difficult to describe, things like fatigue. Talking about how tired you are, as you can imagine, would be very, very challenging. It's so subjective, but it's very real. And then things like malaise, which is kind of a feeling of non-specific, not feeling well, feeling yucky. Dyspnea, which means difficulty breathing, which can come and go, can be related to walking or activity or not. Weakness, and then odor, what I was kind of alluding to, if there's incontinence issues. Sometimes people have wounds that may not have a very nice odor, and it can be really challenging to avoid others being able to perceive that odor. So again, you're going to start to see some recurrent themes in how many of these domains kind of overlap with each other, and how if there's something wrong in one, it's going to trigger something wrong in another domain. And it can be like dominoes. So again, when you're sick, it may change your ability to do the things that you care about. So for example, cultural values, beliefs, or practices. What if it's part of your belief system to eat certain things at a certain time? I'm thinking about, for example, Ramadan, or that's just one of the examples. What if your medical condition made it impossible for you to observe those practices that mean so much to you? That would be pretty difficult. Changing role in family. You can have the most wonderful, loving, supportive family ever, but still be suffering greatly because your role in the family, whatever it may be, whether it's the patriarch, the breadwinner, so to speak, the disciplinarian, the head of the family, when you become sick, it's almost a guarantee that you're not going to be able to be that same person or take up that very same role that you were before. And that can be very hard to get used to. Isolation and abandonment, again, you can have a wonderful family, you can have a wonderful social support structure, but still become isolated, because what if leaving the home is really difficult? What if it's dangerous or even impossible? That can definitely lead to feelings of abandonment, especially if your loved ones are going on to continue to enjoy the things that you once were. Of course, most folks would like their loved ones to continue to carry on doing the things that they love despite their illness, but it's a very complicated emotional situation. Diminished privacy and intimacy. How many people have experienced having to, let's say, change clothes on their father, or take their mother to the toilet, or bathe, an aunt? These things might be very, very necessary. There may not be another person to do it, and you may have to deal with the uncomfortable situation of really taking away any privacy you may have had. When people become ill, it's almost certainly going to disrupt everything that they know. Sometimes in a small way, sometimes in a barely perceptible way, and other times in a huge way. That can include your job, going to work every day, your exercise routine, any sports, any fun things you like to do, meet with friends, book club, Bible study, whatever the case may be. If you're no longer able to do that, that can be very, very difficult. On the tails of that, if your normal routines were the routines that brought home the finances to the family, well, that's definitely going to result in financial stress. And of course, as luck would have it, most people don't need less when they're dealing with a complex illness. Most people need more financial assistance. And they're just not able to get it in many cases. And then legal. I included this because it can really become a problem, especially in the family unit, regardless of how loving and supportive a family might be. I've seen families really butt heads on who's going to be the power of attorney for our loved one who's ill. Who is going to handle the will? Who's going to handle financial issues? Who's going to handle, let's say, the family business that had been handed down for generations, and now perhaps the person that's currently managing the family business has become sick. Imagine having to sell that family business instead of passing it on to maybe your children who are not old enough quite yet, whatever the case may be. Psychological. It depends really on your personal view of how much you think the psychological component can affect your overall quality of life and your overall joy of life. But I would say that in my experience, working with people with complex illness, it would be impossible to not affect your psychological self. For example, people who have been lucky enough to have a very healthy mental health are now having to deal with what it's like to have depressed mood, let's say, or what it might be like to have anxiety for the very first time in your life about what comes next in my treatment, for example. This might be not only unpleasant, but completely new and completely unencountered before. Unfamiliar or augmented emotions. That has to do with grief in many cases, and the grief that people experience when they learn that the future that they had planned for themselves in a certain manner is now going to look very, very different. That can be a grieving process as well. And what we see come out in the grieving process many times is anger. A lot of times, if we're with a patient who just has received some really negative news about their health, sometimes we just kind of stand back and let them be angry because it's so expected. And then once they've kind of gotten that out of their system, we try and see how much we can support them in the next feelings of the loneliness and the hopelessness. There is a significant fear among those who are sick that they have inconvenienced people by being sick. If I had a nickel for how many people apologize constantly to their loved ones about maybe not being able to do a certain thing on their own, that fear is very real. And in some families, it can actually be a true burden for those that maybe aren't prepared to care for a sick loved one. There's a huge loss of control. When you no longer are able to control what your body does, can be really frightening. Kind of goes along with a lot of the anger that you can see. If you're used to, for 40, 50 years, being able to do a certain thing without a care in the world, without a second thought, and suddenly it's nearly impossible, that would be very difficult to adapt to. It goes without saying that people with complex disease many times actually physically look different because of the disease. So we see extreme weight loss, we see hair loss, we may see differences in actually the parts of the body. For example, people that need amputations. Some people define themselves by their physical self. We all do to some extent. We all want to look nice on the outside. And when you suddenly really have that control taken away from you to be able to put on your best dress and put your best face forward, that may affect your desire to even want to be out in public. So spiritual kind of has the fewest bullet points on it, because spiritual is probably, of all the things we're going to talk about, probably the most varied and the most subjective. But suffice to say, there are a fair number of people, religion aside, whatever it may be, who start to feel like their illness may be a punishment. They may start to feel some existential angst. For example, why me? Why have I been the one to bear this disease or problem when I've been a good person my whole life? I've tried to help people, and now look what's happening to me. Is this fair? And these are all questions that, for a person who really values their spiritual self, they could be helped by talking with someone of their faith, or maybe just regular counseling, or maybe someone from their own church. So again, in the context of talking to you as a potential patient, or at least someone that is interested in palliative care and the notion of helping people live their best life, these are the types of things that I try and ask to allow the patient to share as much as possible. And again, this is just kind of a skeleton. How are you feeling? What hurts? Does nothing hurt? What are you worried about in the future? I very frequently will ask a patient, what do you think might be the most helpful thing I can do for you? I do think that it is very important that you, as the patient, have a chance to really open your mouth and vent out what you're experiencing and the feelings, and allow the clinician, whoever that may be, palliative care doctor perhaps, to use that information to support you. I do try and make sure that my patient is absolutely certain that I'm in the moment with he or she, looking them in the eye, facing my body towards them. I do try, and once a patient kind of lets me in a little bit, I try to triage out the things that we might be able to address first that might have the most bang for your buck, if you will, and set goals, small at first. I do think it's important to be physically comfortable before you're setting goals for your future. So we certainly address that first. And, you may not be able to come to a resolution per se. You may not get exactly the answer or the relief you were seeking. But when you see someone who, whether it's a palliative care provider or someone else who's just trying to provide you with support, the key is to know that you have a provider that's going to walk that whole journey with you, good, bad, or indifferent, whether we're successful or not. The success lies in maintaining that connection. So just a couple other things that I think are really important. Medications. Medications can be wonderful. They can also be burdensome in and of themselves. People with complex disease very frequently end up with polypharmacy or being on 10 or more medications, generally from a number of different providers. Maybe the oncologist, maybe the kidney specialist, maybe the heart specialist. And it is very useful to go through those medicines and make sure that there is a specific purpose for every single one of them. And you, as the patient, you should be able to take a look at your medicines and know exactly why you're on each of them. Maybe not, the small details, but you should definitely know in general what they're for. And you know what? If there's confusion, it may mean that that medicine is not necessary. Talk to your doctor before you go throwing anything out, though, please. I always try to pick up the phone to help collaborate. In a complex patient, I do not think just one doctor can deal with all of the things that come with being complex. So I certainly try and make an effort to talk. You as the patient should expect that and encourage that. It's perfectly okay to say something like, hey, can you call my oncologist with this thought? Or can you check with so-and-so before we start this new medication? That is definitely part of a trusting relationship with a provider that is going to help you have the best quality of life possible. And then finally, at the end of my little list is I try not to make the issue of multiple doctors worse by referring to many other places. I think every single move that you make in the scenario of a complex disease should be kind of analyzed very, very briefly. Okay, I'm going to go see the cardiologist next week. Now, how is this going to benefit me? And ask your doctor, what exactly is this going to do for me? It's perfectly okay to do that. Remember that any provider, doctor or nurse practitioner or what have you, that is not willing to answer these types of very reasonable questions, they may not be the provider for you. So a fair amount of all of this that I've been talking about thus far has been, number one, to clue you in about what our thought process is, but also to really normalize the notion of self-empowerment and self-advocacy. Knowing the types of things that a thorough doctor is looking for when you see them for symptoms can be really helpful, because you can essentially hand a whole bunch of information to that doctor. They're going to do a way better job at helping you with your symptoms if you can, thoughtfully communicate as much as you can about them. I think that may be okay. So any clinician worth their salt is going to do a physical assessment, right? It should be thorough. It should be methodical, kind of very purpose-driven. And there's my little catchphrase, ensure you know why they take every medication on their list. Focus on function and quality of life. So function and quality of life in the palliative care world is really what it's all about. One person's trash is another person's treasure. And that is a little bit of a kind of a harsh way to put it, but for one person, a quality of life where they are just able to sit quietly and read a book may be heaven. For another person, only being able to do that may be utterly unacceptable. It's important to characterize that. And because in the book reader, function just needs to be adequate enough to relax in a chair. For another person, function may include being able to go to the grocery store. I like to focus on what a patient wants to be able to do and try and shape the interventions so hopefully they can help you achieve whatever that activity is that you want to be able to do. So this is kind of a classic way to think about pain. And again, how it can be useful to you is to just know that pain isn't just my knee hurts. Pain can be so much more than that. Where does it hurt? What does it feel like? What was happening when you first noticed it? What do you do that makes it better? What have you noticed are other problems that come with that? All of those things, if your doctor doesn't ask for it in, a list manner, they're definitely thinking about all of them. So the more that you can give them, the higher the chance is that you will hopefully meet the needs that you're hoping. I think that might be, yep, that's the end of my presentation. It is a little early, but I'd be happy to take any questions or anything you might have.
Thank you so much, Dr. Fertal, for sharing your insight and knowledge about palliative care. And we do have a couple of questions. So our first question from the audience is, can I receive palliative services outside of the hospital after being discharged?
Yes, you sure can, as long as there is an outpatient palliative care clinic near you. Now, it is something that's growing pretty exponentially, but it's definitely not available in all places. I can only kind of vouch for the places that I'm familiar with. So here in Orange, yes, definitely. Fullerton, Newport Beach. And that's about the only places I can very specifically comment on, but you can definitely look it up, see if there's an outpatient palliative care clinic in your area.
Thank you. And then we have another question right here, and it says, will my doctor need to recommend palliative care services?
You do need a referral to see a palliative care doctor, just like any other medical specialty.
And we have another question
in the same manner as well. Sorry.
Oh, no, don't worry. And also, how do you find a palliative care doctor just like yourself?
How do you find? Well, your primary care doctor should probably be your very first source. More and more these days, most primary care doctors, at least in a non-rural area, is going to probably have a palliative care doctor that they work with. But the internet is a good source. I would just say that a little bit of digging is probably necessary. If you Google the keywords, you can do a little investigation. I wish there was a centralized place, but there really isn't.
Thank you. And we also have another question. It says, can I pursue active treatment for my diagnosis if I'm doing palliative care?
A million times yes. That's truly the heart of palliative care. You do not need to stop pursuing treatment for whatever your particular disease is. Let's say a cancer, because that's a pretty common one. You absolutely need not stop that. We do it hand in hand all the time, every day.
Yeah. And I have another question. It says, will I have a new doctor if I use palliative care services?
Will you have a new well, you will have a palliative care provider, yes. Whether it's a doctor or a nurse practitioner or whatever the setup is. Yeah, there's no way to escape getting a new provider. But that doesn't mean that you need to stop seeing your existing providers at all. Like I said, hand in hand every day.
Mm-hmm. Just like you said, they collaborate with each other, so that's the best part.
Yeah, it's one of the
yeah. And we do have a question also about the participants want to know if they are able to receive your PowerPoint or a type of handout that we can send to them virtually. That you might have that and you can get to us.
Yeah, you're welcome to my handout if you'd like. I don't really have any I'm sorry, you can have my PowerPoint. I don't really have like a handout written up, but be my guest. I'm welcome you to take it.
Thank you. Thank you so much. So
Can
we will
you make that available for them?
yeah, to make it available for them, we can send it out to them as a PDF so they're able to see it.
All yours.
Thank you, Dr. Dean. And that is actually the last question that we have for you today. So I want to thank you so much for doing this presentation and the Q&A for us and for the community out here that's watching right now. Thank you so much, Dr. Sutal.
My pleasure. Everybody have a great weekend.
And I want to say thank you all so much for being here, for being on our audience. Thank you for joining us. And please feel free to check out the on-demand sessions, the author's corner, the resources, and the survivor testimonials. And they will be in the links above. This talk will also be added to the on-demand section, so you can watch this again, or you can share it with your friends and your family. Registration for this event will continue to be open until tomorrow, till Saturday morning. So please be sure to share this virtual conference with others, if anybody you know that might be interested in all of this great information that we have here at this conference for you. And if you would like to know more about the Pink Ribbon Place and our no-cost services, please be sure to follow us on Facebook and on Instagram at the Pink Ribbon Place, or you can visit our website at pink.rchs.org. And at the end of this conference, we will be sending out a survey email, so please watch out for that. And once you do this survey, you can let us know how we did. You can give us your feedback, and then you will have the opportunity to win some amazing prizes for your participation in the survey. And our next live session is going to be tomorrow. It'll be called Navigating Cannabis Use for Cancer, which will be available to watch live at 9 a.m. So please come on back, watch anything that you would like to watch on the on-demand services, and to watch the talks and see what's coming on next, just look at the links above. Thank you so much for joining us again, and have a great day. Bye.